If I had to describe my role as a pediatrician in the care of my patients, I think one of the first things that comes to mind is being an advocate for good health. So I think one of the important roles I think a pediatrician should play is teaching the family and the patients about how to develop strong, healthy foundations as they move forward into their adult life. Because we're learning more and more that your early years may play an important role on your adult health. So I think an advocate in the sense of establishing strong, healthy foundations as they move forward in their life, but also an advocate in the sense of helping them navigate a very complex healthcare system as far as seeing specialists, helping to coordinate care, especially for those more critically ill and complicated patients. For me, I think if I look at my role or how I'd like to practice medicine in pediatrics, it's really a combination of three areas. And one would be looking at the recommendations, the scientific basis for what we recommend as pediatricians, what we call the evidence-based medicine, but combining that with my clinical experience, what I've seen over, 10 plus years of being in pediatrics during my training and as a pediatrician, and combining that with what the family's needs are. So I think that's one thing I've definitely learned over time is that to be a good clinician, you have to remember your clinical acumen and your clinical experience, but you really have to listen to the parents because they are with their child 24/7. They know their child best, and they have a breadth of experience and knowledge that you really need to consider and respect.